Hello friends, welcome back to our YouTube channel Best Online Medical Lectures. In the last videos, we have discussed about the anatomy and physiology of the thyroid gland. Okay, that is the physiology of the thyroid hormones. Today, we will discuss about the thyroid disorders, that is the diseases of the thyroid gland. What are the various diseases of the thyroid gland? Before going in detail about the disorders of the thyroid gland, let's see some epidemiology or statistics regarding this thyroid disorders. So, thyroid disorders is one of the commonest disorders in India as well as in the world. So, according to one estimate, in India around 42 million people are suffering from the thyroid disorders. And another study says that 1 in 10 adults in India are suffering from hypothyroidism, that is decrease in the thyroid hormone secretion. Also, congenital hypothyroidism, that is the thyroid problem since birth. It is seen in India in 1 out of 2,640 neonates born. Okay, that is the newborn. And the prevalence of the hypothyroidism was 3.9%. So, it is the second most common endocrine disorder after diabetes mellitus. So, it is more commonly seen in females and the incidence increases with the age. So, it is seen in around 2 to 3% of the older women. So, after knowing some facts about these thyroid disorders, now come to the main topic, that is what are the disorders of the thyroid gland. So, we divide the disorders of the thyroid gland into two important headings, that is hypothyroidism and hyperthyroidism. In today's lecture, we will discuss about what are the causes of hypothyroidism and what are the causes of hyperthyroidism. Before that, I would like to show the thyroid gland. If you remember the anatomy of the thyroid gland, so it's a butterfly shaped gland. If you remember, so it secretes thyroid hormones. So important thyroid hormones is T3 and T4, that is triiodothyronine and tetraiodothyronine. This T4 it is also known as thyroxine. Also it secretes the calcitonin, but the thyroid hormones means T3 and T4. Okay, so basically there are two disorders. One is hyperthyroidism and another one is hypothyroidism. Okay, first I'll write about hypothyroidism. And second one is hyperthyroidism. So what do you mean by hypothyroidism and what do you mean by hyperthyroidism? So hypo means decrease. So as the name indicates, hypothyroidism means decrease in the quantity of the thyroid hormones into the blood. So whenever there is decreased secretion of the thyroid hormones into the blood, it is known as hypothyroidism, whereas hyperthyroidism means increase in the secretion of the thyroid hormones into the blood. Whenever this T3 or T4 are secreted more than the normal quantity, then it is known as hyperthyroidism. Okay, so but what exactly it causes, that is what are the causes of hypothyroidism and hyperthyroidism, we'll discuss now. So first we will try to enumerate the causes of hypothyroidism, why this diseases actually occurs, why there will be decrease in the thyroid hormone secretion as such. So basically this disorder of the hypothyroidism is divided into two main side headings, that is primary and secondary. Along with that we have transient also, but first is primary hypothyroidism and second is secondary hypothyroidism. So primary hypothyroidism means the disorders or the diseases of the thyroid gland itself. So any disease which causes decrease in the level of the thyroid hormone secretion into the blood is known as primary hypothyroidism. Whereas secondary hypothyroidism is usually the diseases of the pituitary gland. If you remember, pituitary gland will secrete one important hormone, thyroid stimulating hormone. So this thyroid stimulating hormone will stimulate the follicular cells of the thyroid gland to secrete T3 and T4. So when there is any diseases of this pituitary gland, then that disorders are called as secondary hypothyroidism. So broadly they are divided into primary and secondary hypothyroidism. However, there are other types we will discuss. First we will discuss about the primary hypothyroidism. What exactly this primary hypothyroidism means, or what are the causes of this primary hypothyroidism. So first important cause is autoimmune hypothyroidism. That is, there are certain diseases which are autoimmune nature. That is, the immune system of our body produces certain cells or antibodies which will destroy this cell, destroy the cells of the thyroid follicles. Okay, so because of this destruction by our own immune system, antibodies or certain chemicals or cells like example Hashimotosthyroiditis, where there is a chronic infiltration of the lymphocytes in the thyroid glands which causes destruction of these thyroid cells, which leads to decrease in the thyroid hormones. Similarly, atrophic thyroiditis, okay, where there is a decrease in the size of the cell. So first cause of the primary hypothyroidism is autoimmune disorder. Then iatrogenic hypothyroidism. Iatrogenic means due to some procedures of treatment, it will lead to the decrease in the thyroid hormone secretion. Example, iodine 131 treatment. So generally this radioactive iodine is given for the Graves disease or hyperthyroidism. When it is given excess, one of the side effect is it will destroy the thyroid tissue and it will lead to hypothyroidism, or due to some surgery like subtotal or total thyroidectomy, or external irradiation of the neck for lymphoma or cancer, that is radiotherapy for other cancers in the neck, that is lymphoma, that will causes the destruction of the thyroid tissue and causes decrease in the thyroid hormones. Then certain drugs means medicines which we give for other diseases like iodine excess, lithium, antithyroid drugs, para-aminosalicylic acid, interferon alpha, cytokines, aminoglutathione, tyrosine kinase inhibitors like sunitinib. Okay, so these drugs when given for other disorders, then one of the side effect is they will damages this thyroid tissue and there is decrease in the thyroid hormone secretion. That is, the drugs or medicines also causes decrease in the thyroid hormone secretion. Then fourth is again one of the commonest disorder, that is congenital hypothyroidism. That is by birth itself. By birth itself there is absent of the thyroid gland, or there is ectopic, that is the thyroid tissue is present in some other place than the normal, or there is dysharmonogenesis, that is there by birth itself there is a defect in the production of the thyroid hormones, and also thyroid stimulating hormone receptor mutation, that is the receptors itself causes there is a changes in the receptors and this TSH can't stimulate and thyroid hormone secretion is reduced. Then again in India or in other countries where there is a deficient in iodine in the food, that also is one of the causes of hypothyroidism. Okay, then some infiltrative disorders. Infiltrative disorders mean disorders in which some chemicals or inflammatory cells get infiltrated in the thyroid tissue, which causes the destruction of the thyroid tissue and there is reduce in the thyroid hormones, like amyloidosis. Amyloidosis, where there is an abnormal protein known as amyloid gets deposited in the thyroid gland and decrease in the thyroid hormone secretion. Then sarcoidosis, similarly we have hemochromatosis, scleroderma, cystinosis, renal thyroiditis. So this disease causes some inflammatory material or inflammatory cells to accumulate here and it will lead to the decrease in the thyroid hormone secretion. Then one more is overexpression of type 3 deiodinase. So this deiodinase enzyme, basically this deiodinase converts T4 into T3 and also this T4 and T3 into inactive metabolites. So inactive metabolites, so active T3 and T4 are converted into inactive metabolites due to the overexpression of this type 3 deiodinase, and therefore there is a decrease in the thyroid hormone secretion. Okay, so these are the possible causes of the primary hypothyroidism. So primary hypothyroidism means diseases of the thyroid gland itself, any diseases which will affect directly the thyroid gland and which causes the decrease in the secretion of the thyroid hormone. So we have just now enumerated. So the commonest one is the autoimmune, that is Hashimotosthyroiditis, also iodine deficiency. Okay, then along with the, apart from this primary hypothyroidism, we have one more type of hypothyroidism known as transient hypothyroidism. Transient means temporary. Okay, so sometimes that hypothyroidism is temporary. Okay, so what are the causes? Like silent thyroiditis, including the postpartum thyroiditis, that is post pregnancy, that is known as postpartum thyroiditis. So there is thyroid hormone will decrease immediately after pregnancy, known as postpartum thyroiditis. Subacute thyroiditis, withdrawal of the supraphysiological thyroxine, then after iodine, radioactive iodine, iodine 131 treatment or subtotal thyroidectomy surgery for Graves' disease. Okay, so because of this procedures or therapeutic procedures, so this transient or temporary hypothyroidism is seen. Then we have the second type of the hypothyroidism known as secondary hypothyroidism, where the defect is in the pituitary gland. Okay, so first causes of this is hypopituitarism, that is this pituitary gland is secreting less TSH, that is thyroid stimulating hormone. Because of that less secretion of TSH, there is decrease in the thyroid hormone secretion. So tumors, any tumors of the pituitary gland, pituitary surgery or irradiation, infiltrative disorders, Sheehan's syndrome, that is after the labor or during the after the delivery, then if there is a more bleeding, postpartum bleeding, then because of that bleeding there is hypoxia to the tissues and also to the thyroid gland, so that causes the destruction of the thyroid gland and it causes decrease in the thyroid hormone secretion. Okay, so basically it will cause us in Sheehan syndrome hypopituitarism, that is the central hypothyroidism. It causes destruction of the pituitary gland, which causes secretion of the decrease in the TSH, which ultimately lead to decrease in the T3 and T4. Then any trauma, head injuries and all, which causes trauma to the pituitary gland. Then the genetic forms of the combined pituitary deficiencies. So these are the causes of the hypopituitarism. Then isolated TSH deficiency, that is pituitary gland is isolatedly, there is a deficiency of the TSH or inactivity. Then also bexoretine treatment. Okay, it's one of the drug used for the treatment of the cutaneous T cell lymphoma. So one of the side effects is it will destroy the restrict the pituitary gland secretions, so there will decrease in the TSH hormone. Then hypothalamic diseases. Okay, hypothalamic, if you remember, hypothalamus secretes one important hormone, thyroid releasing hormone. So thyroid releasing hormone is when it is deficient due to the damage of the hypothalamic secretion by the tumors, trauma or infiltrative disorders and some idiopathic causes, so it will lead to decrease in the thyroid hormone secretion. Okay, so these are the causes of the secondary hypothyroidism. Okay, so hypothyroidism means decrease in the thyroid gland secretion. So hypothyroidism basically mainly of two types, primary and secondary. Primary, the disorder of the thyroid gland itself. Secondary, the disorder of the pituitary gland. Okay, so we have discussed the causes. Along with that, there was a transient hypothyroidism also. Now the next disorder, the other form of the disorder is hyperthyroidism. Hyperthyroidism, that is increase in the thyroid hormone secretion. Till now what we have discussed was hypothyroidism, decrease. Now hyperthyroidism. What are the causes of increase in the thyroid hormone level into the blood? That is the disorders. So causes, so enumerate the causes of hyperthyroidism, our second objectives of today's lecture. So again, this hyperthyroidism is basically of two types, primary and secondary. Okay, now we are discussing about the hyperthyroidism. Okay, so primary hyperthyroidism is again the disorder of the thyroid gland itself. That problem is at the level of the thyroid gland, where there is increase in the secretion of the thyroid hormones. So basically the most important cause is Graves' disease. It's an autoimmune disorder. Okay, autoimmune disorder where there are autoantibodies like thyroid stimulating immunoglobulin, which causes the increased stimulation of the thyroid gland to secrete T3 and T4. Okay, then we have toxic multinodular goiter. So there will be nodule formation in the thyroid gland, which acts as an autonomous, they will secrete more amount of the thyroid hormones. Then we have toxic adenoma, then functioning thyroid carcinoma or metastasis, activating mutations of the GESC alpha, that is the McCune-Albright syndrome. Stroma ovary, it is a teratoma of the ovary. Okay, so the thyroid tissue will be present at the level of the ovary. Okay, it's a teratoma. So that from their ectopic tissues, that more thyroid gland is more thyroid hormones are secreted. Then drugs like iodine excess, also known as jod-based dose phenomena. We'll discuss about this in the future videos. So these are the causes of the primary hyperthyroidism, that is the diseases of the thyroid gland which causes increase in the thyroid hormone secretion. Then there can be thyrotoxicosis without hyperthyroidism. That is, thyrotoxicosis means clinical syndrome of signs and symptoms where there is excess of thyroid gland activity. Hyperthyroidism in general means increased synthesis and secretion of thyroid hormone is known as hyperthyroidism, whereas the clinical syndrome of hyperthyroidism, just signs and symptoms without increase in the T3 T4, it is known as without or with increase, it is known as thyrotoxicosis. So the causes are subacute thyroiditis, that is inflammation of the thyroid gland, silent thyroiditis. Then other causes of thyroid destruction like amiodarone treatment, radiation, infarction of the adenoma, then injection of excess thyroid hormone, that is thyrotoxicosis factitious or thyroid tissue. Okay, so these are the thyroid toxicosis without hyperthyroidism. Then second important one is again here also secondary hyperthyroidism. Again, the secondary hyperthyroidism is defect in the level of the pituitary. So thyroid gland is normal, there is problem with the pituitary gland. So like TSH secreting pituitary adenoma. So any tumors like here pituitary adenoma which causes excess secretion of TSH. When there is excess secretion of TSH, that is thyroid stimulating hormone, then this TSH will stimulate the thyroid gland to secrete more T3 and T4, that is hyperthyroidism. Okay, then thyroid hormone resistance syndrome, then chronic gonadotrophin secreting tumors, and gestational thyrotoxicosis. So these are the secondary causes of hyperthyroidism. Okay, so basically let me revise. There are two types of thyroid disorders. One is hypothyroidism, that is decrease in the thyroid hormone secretion. Another one is hyperthyroidism, that is increase in the thyroid hormone secretion. And this hypo and hyper, basically broadly there are of two types. However, there are of transient and other forms also, but mainly there are of two types, primary and secondary. Primary hypo or primary hyperthyroidism mainly means the diseases of the thyroid gland which causes decrease or increase in the thyroid hormone secretion. Similarly, secondary hypo or hyperthyroidism are the diseases of the pituitary gland which causes there is decrease in the thyroid hormone secretion or increase in the thyroid hormone secretion. Okay, so this was a very big lengthy list of the disorders of the thyroid gland. So this list for the sake of genuineness I have taken from the textbook of internal medicine from Harrison's. Okay, Harrison's textbook of internal medicine, which is considered as a standard textbook for general medicine or internal medicine. So I have taken this list, so it will be very much helpful for theory examination also to enumerate the causes of the hypothyroidism, to enumerate the causes of the hyperthyroidism, also for the clinical knowledge to know what are the possible causes or of the thyroid diseases, that is hypo or hyper. I have enumerated most of them. So from Indian point of view, that is from the Indian University examination, so according to the new National Medical Commission criteria, that is the CBME new criteria, so there is one competency in internal medicine, that is general medicine, that is 12.1, describe the epidemiology and pathogenesis of the hypothyroidism and hyperthyroidism, including the influence of the iodine deficiency and autoimmunity in the pathogenesis of the thyroid disease. Okay, so this is one of the part of this competency. Then along with that, in pathology also you can study this thing. Then also in physiology and surgery, okay, surgery, then physiology, PY 8.2, we are already discussed about this synthesis and secretion in our previous videos of the thyroid gland. If those who have not seen that, please go through that. Then also other pathology 32.3. So all these subjects are interrelated, and all these subjects have given about the thyroid gland. So this is the part 1 video of the thyroid disorders. In the next video, we'll discuss about the clinical features of the hypo and hyperthyroidism, and the further subsequent videos will discuss about the diagnosis and what are the tests to be performed for the diagnosis of the thyroid disorders, and finally the treatment. So please subscribe our channel for our next coming videos. Thank you one and all.